Stop scrolling for a second. If you're on amlodipine and your blood pressure numbers have been fine, I need you to actually listen to this because fine can change overnight and most people never see it coming. I'm Dr. Claire Brooks. I've spent over 20 years in cardiology, and I'm going to tell you something that might annoy you. The drug is almost never the problem. It's what's happening around the drug. The things nobody warns you about at the pharmacy counter that lands people in my emergency clinic. I'm giving you 5 of those things right now. Stay to the end because there's a 6th one I'm holding back on purpose. It's the one I see backfire the hardest, and if you skip it, you're skipping the part that actually matters most. Let's go. 1. Grapefruit is not a myth you get to ignore. I already know what you're thinking. I've heard this one. Good. Now actually do something about it. Your liver runs an enzyme called CYP3A4. Its entire job is to break down amlodipine at a steady, predictable rate, the rate your dose was calculated around. Grapefruit contains compounds called furanocoumarins, and they jam that enzyme. When it's jammed, amlodipine stops clearing normally. It builds up. Your normal dose starts acting like a much bigger one. What that looks like: pounding headaches, flushing, a heart that suddenly feels like it's racing or skipping, blood pressure crashing hard enough to take your legs out from under you. Here's the part almost nobody tells you. That enzyme block doesn't last an hour. It lasts up to 72 hours from a single glass of juice. 3 days of your liver working against you from one breakfast. Cut grapefruit out entirely, not just near your pill, all day, every day while you're on this medication. Oranges, lemons, limes, tangerines, all fine. Pomelo and Seville oranges carry the same risk, so watch for those too. Quitting cold turkey is how people end up in my ER. This is the one that scares me most, so pay attention. People stop amlodipine for every reason under the sun. They feel better, they forget to refill it, they read something scary online, they decide they'd rather do it naturally. Here's the problem. Amlodipine keeps your artery walls relaxed. Your whole cardiovascular system adjusts to that relaxed state over months. Yank the drug out overnight, and those vessels don't ease back gradually. They can slam shut in a rebound spasm. That's rebound hypertension, and it can push your blood pressure higher than it ever was before you started treatment. I'm talking readings north of 200 systolic in people who were previously stable. At that level, you're looking at stroke risk, hypertensive crisis, kidney damage. If you want off this medication, that decision gets made with your doctor with a tapering schedule that can take weeks. Feeling good on amlodipine isn't proof you don't need it. It might be proof that it's doing exactly its job. 3. Standing still is doing more than you think. Nobody mentions this at the pharmacy, and they should. Amlodipine dilates vessels everywhere, including your legs. That's part of how it works. But when you stand still for a long stretch, gravity pulls blood down into those widened vessels, and your calf muscles, which normally pump blood back up, aren't doing their job because you're not moving. Blood pools, ankles swell. The real danger hits when you finally sit or lie down after standing still too long. That pooled blood has to redistribute fast, and your pressure can drop hard enough to make you dizzy or faint, sometimes with zero warning. If you're going to be on your feet more than 15-20 minutes, a queue, a reception desk, a long ceremony, keep your calves working. Shift your weight, rise up on your toes, and lower slowly. If you can't move at all, tense the calf muscle without moving your foot. And when you finally sit or lie down, do it slowly. Give your circulation a few seconds to catch up. 4. That ibuprofen you're not thinking twice about is fighting your medication. Ibuprofen, naproxen, diclofenac, high-dose aspirin, all easy to grab, all easy to underestimate. NSAIDs make your kidneys hold onto sodium and water, more fluid, more pressure. At the same time, they block prostaglandins, the signals that keep your vessels open. Amlodipine is doing the exact opposite job, opening vessels, easing resistance, balancing fluid. You're taking 2 medications that are directly working against each other. Studies on patients adding regular NSAID used to blood pressure medication show systolic increases in the range of 5-10 millimeters of mercury on average, and for some people, a lot more. What that looks like in real life. Your numbers quietly drift up over weeks, your doctor bumps your dose, and nobody ever connects it back to the ibuprofen sitting in your medicine cabinet. Reach for paracetamol, acetaminophen, first. It doesn't touch your kidneys, sodium handling, or your vascular prostaglandins, and for most everyday pain, it works just as well. If you genuinely need an NSAID, say so to whoever's prescribing it, and actually check your blood pressure while you're on it. Don't guess based on how you feel. 5. Swollen ankles are not your cue to quit the medication. This is the one I see go wrong more than anything else, so listen closely. Ankle swelling hits somewhere between 6 and 12% of people on this drug, more at higher doses. If yours are swelling, you are absolutely not the exception. Here's why it happens. Amlodipine opens arteries more than it opens veins, which creates a pressure mismatch at the capillary level. Fluid leaks into the surrounding tissue and settles wherever gravity takes it. For most people, that's the ankles by evening. And here's what you need to actually hear. In almost every case, this is a comfort problem, not a heart, kidney, or circulation emergency. The fluid is sitting in soft tissue, not building up around your heart or lungs, but quietly stopping the pills over embarrassing swelling. That drags you straight back to point 2, rebound hypertension, a pressure spike that can exceed where you started. If the swelling is bothering you, there are real fixes. A lower dose, switching to a different calcium channel blocker, or a low-dose diuretic. All of them go through your doctor. None of them involve you disappearing from treatment. I want to tell you about a patient. I'll call him Reginald, 71 years old, 3 years stable on amlodipine, no issues. Then, inside about 3 weeks, 3 things stacked on top of each other. His rheumatologist put him on ibuprofen for arthritis. His daughter started bringing him grapefruit juice, thinking it was good for his immunity. And his ankles started swelling more than usual, enough that he was embarrassed and never brought it up at his appointment. So he quietly held off his amlodipine for a few days on his own, hoping the swelling would settle. His daughter found him on the kitchen floor, his systolic pressure on arrival, 217, 4 days in the hospital. He came through it without permanent damage. I'm genuinely thankful for that. But 4 days of hospitalization, a terrified family, and weeks of recovery over something completely preventable. 3 manageable factors, stacked together, turned into a crisis. A word on alcohol and salt, while we're here. 2 more things worth a mention, since they come up constantly in my clinic. Alcohol relaxes blood vessels on its own, which sounds harmless until you remember amlodipine is already doing that job. Combine the two, and the dizziness, flushing, and blood pressure dips can be more pronounced than either one alone, especially with more than a drink or 2, or on an empty stomach. It's not a hard never for most people, but it's worth knowing your own reaction before you're 3 drinks in at a wedding. Salt is the other one. Amlodipine doesn't interact with sodium the way a diuretic does, but a high salt diet still works against everything your blood pressure medication is trying to accomplish. Processed foods, takeaway meals, and anything canned are usually the biggest hidden sources, far more than the salt shaker on your own table. Common questions I get asked constantly: can I take it with food? Yes, with or without food is fine, just be consistent day to day so your levels stay steady. What if I miss a dose? Take it as soon as you remember, unless it's nearly time for the next one, then skip the missed one. Never double up to catch up. Does it matter what time of day I take it? Morning or evening both work. What matters most is picking one time and sticking to it, since amlodipine has a long half-life and doesn't need to be timed precisely around meals or sleep. Can I still exercise? Generally, yes, and it's good for you. Just be aware that a hot gym or intense session can amplify the same blood pooling and dizziness issues we talked about with standing still. So hydrate and cool down gradually rather than stopping abruptly. 6. The one I made you wait for. Here it is, not telling every provider you see that you're on amlodipine, before dental work, before any procedure, before anything involving fasting. Fasting drops your circulating fluid volume. Combine that with vessels that are already dilated from your medication, and your heart suddenly has a lot less to pump against. Add local anesthetic, add sedation, add the stress response of even a routine procedure. Now your provider is managing a situation they never saw coming because they didn't know you were on it. The fix costs you 5 seconds. Say it every time. to your dentist, your dermatologist, the intake nurse, anyone touching your body in any procedure. Write it on every form. This isn't oversharing, it's the single piece of information that changes how they monitor you. Before you go, if you know someone on blood pressure medication who's never heard any of this, send them this. Information sitting unread helps nobody. And if ankle swelling is something you or someone you love is dealing with right now, I've got a full breakdown on what actually works, without stopping your medication, coming next. Your cardiovascular system works harder and more quietly than almost anything else in your body. Give it the respect it's earned.